Welcome and thank you for joining us for the People Worth Knowing interview. Please introduce yourself.
Hi, everyone. I'm Stephen Lee, the Executive Director at NASTAD. I have been in the HIV field for over 25 years. I started my career as a primary care doctor, providing care to people living with HIV. In the past 13 years, I worked in the global HIV arena, supporting the design, implementation, and scale-up of HIV prevention care and treatment services in sub-Saharan Africa, working at the Elizabeth Glaser Pediatric AIDS Foundation. I joined NASTAD as the Executive Director in February 2020.
So, what got you started in this work?
When I was a medical student and as a medical intern and medical resident, in the early to mid 1990s, many of the patients that I saw on the medical wards were young men living with HIV or experiencing the consequences of AIDS. As a young gay man at the time, seeing how this was impacting my patients and seeing how this was impacting many of us in our community, this created a sense of duty and commitment to help my patients and to end the HIV epidemic.
What do you think really needs to be accomplished in your field?
You know, over the years, we have learned, and we've certainly come to know, that the real causes of poor health outcomes, particularly for minority and highly marginalized groups, are things related to discrimination, stigma, and the so-called social determinants of health, things such as housing or lack thereof, unemployment, underemployment, food insecurity, and poor nutrition. This is what drives my commitment. This is what drives my commitment to health equity and social justice. One of the reasons I joined NASTAD was its leadership in the HIV, hepatitis, and drug user health movements. We have been at the forefront of both practical and policy level efforts to address these disparities. Ideally, we need to create and adopt systems of care that are person and people-centric and providing comprehensive services in order to address the many barriers that people impacted by HIV, hepatitis, and overdose issues experience. In order to do that, we have to work with entities and stakeholders outside of our immediate networks, creating real and genuine and meaningful coalitions to address what overall health and health equity looks like.
What did you want to be when you were a little kid?
That's a great question. And I've always wanted to be a doctor ever since I was 12 or 13 years old. Initially, I thought I wanted to be a urologist because I have really memories of my dad experiencing urinary and prostate problems at an early age. But once I started medical school and I really started doing the clinical rotations, I knew I wanted to be an internal medicine doctor and to focus on primary care.
What's your favorite snack and why?
I like anything with peanut butter. My favorite is actually peanut butter and toast. I have that every morning, and I've been doing that for many years. Generally, I prefer savory versus sweet snacks, and I know that there's a debate as to whether peanut butter is savory or sweet. I land firmly in the camp that peanut butter is savory.
Do you have a hobby?
I like to exercise. I run 3 to 4 miles 4 times a week. On the days that I don't run, I have a stationary bike at home that I use. And actually during this COVID-19 lockdown, I set up a home gym in my basement so that I can continue to lift weights. I really do try to get my 10,000 steps in every day.
If people want to help NASTAD, what can they do?
So speaking to the points above, we recognize that we're not going to end these intersecting syndemics and improve the health outcomes of people who live with HIV or hepatitis and those who are experiencing drug use without partnerships and without strong coalitions. I encourage individuals and organizations to join us in our collective efforts on this front. Individuals can stay in touch with our advocacy efforts and/or have opportunities to access our technical assistance through our website, through Facebook, through Twitter, and through Instagram.